So I'm in my virtual studio, this very sacred place, and I invited Jayne. Jayne PLANTE. It's a beautiful name. French, maybe PLANTE.
It is French, although it's Jayne PLANTE.
PLANTE.
Yes.
Oh wow, even more French. So
Yeah.
for anyone who doesn't know, I'm Dr. Tova Goldfine, and this is TMS Roundtable Recovery. And we often go live, but sometimes I'll be on an offline recording so I'm able to catch a story and meet people and bring it to you, to my YouTube, to my Facebook, to wherever you can find me, into your home, from my heart to your home, from Jayne and mine's heart and home to your heart and home. We're bringing healing, recovery. And so I get comments on my YouTube channel, and Jayne commented, and I was like, this is an interesting story. Would you like to be in my studio and talk with me? And she was just like, so many people are like, I was able to heal, and I want to help others, and I'm not going to go out there like you, but I'm going to get out there. And so I am honored and always to be sitting next to someone who's been able to apply and implement some of these mind-body methods and heal themselves from pain or autoimmune symptoms. So I'm just going to ask you to just start from like hello, when things started to happen and you began to see something going on in your mind and body, and how that transformed. Can you start?
Yes. Well, and I'm very honored to be here as well. And since my recovery, I am passionate about, spreading the word about mind-body modalities, because it took me 37 years to discover mind-body modalities. That's how long I was in chronic symptoms before, I found any of this. So that's why I'm here, to spread hope, but also, to tell people it doesn't matter how long you've had your chronic symptoms, that healing is possible no matter how long it's been.
Great. Amazing.
1985, I was in a car accident. I was 20 years old, and that's when my journey into chronic pain started. And off I went to physiotherapy. And the pain never really went away from that point on. I was 20, and soon after the car accident, I started post-secondary education to become a dental hygienist. And that, as people know, involves a lot of static positions, leaning over people, holding the same positions. So that, plus the car accident, was always the reasons the medical profession gave me, as to why I had chronic back pain. And over the years, several things showed up on my MRIs and my CAT scans. Degenerative disc disease. I had nerve impingement at C6, C7, and my hands would turn, my fingers would turn purple and numb. Herniated discs. I said I had repetitive strain injury, whiplash after the car accident. So in my mind, those were always the reasons why I had the chronic pain. And I was also told by a family doctor, chronic pain is forever. You just have to learn how to cope with it. So over the years, the pain did move, though, which now I realize is, a symptom of PMS, but I didn't know that at the time. It started in my lower back and moved to my mid back, my upper back, shoulders, neck, base of the skull. And it got very intense. I still was trying to work, throughout all those years of the pain, but tried lots of different medications. I was on medication for nerve pain, anti-inflammatories, opioids, medical marijuana, muscle relaxants. I tried lots of natural supplements as well. I saw, over the 37 years, I had 5 different family doctors. I saw 2 different orthopedic surgeons, 2 different neurologists. And as you can imagine, countless physiotherapists, chiropractor, acupuncture, Reiki, athletic therapists, massage. I mean, my calendar was full of appointments, just trying to get some type of relief. So my life became very small. I was still working, but basically I would walk in the door from work and lie out on my kitchen floor, because that was where I could find the most relief, was lying out flat. Wow. But any type of long sitting or long standing still would bring on a lot of the chronic pain. So over the years, I've lied out flat in some very interesting places.
Tell us a lot about floors and ceilings.
Yes, exactly. I mean, I've lied on public benches.
Wow.
On the grass out in, the back seat of our car. I mean, it got to the point that I couldn't, our son lives 90 minutes, our adult son lives 90 minutes from where we live. And I couldn't sit in the car that far to go visit him. So I would put my seatbelt on and lie down in the back seat, and my husband would drive down there. And once we arrived, I would walk into my son's apartment and lie on the floor to visit, while they sat on the couch.
Unbelievable.
So I felt that every social event that, I was either required to go to or asked to go to, it just became that it just revolved around, how am I going to manage that? Am I going to be able to lie down somewhere? What's the furniture going to be like? Is the chair going to be okay to sit in? For how long? How long am I going to have to sit? How long am I going to have to stand still? Just on and on. And not just the physical aspect of the social event, but also just having to pretend in front of everybody that I was doing okay.
That's in itself a conflict, and
it is
not being authentic, and that's also very energy to do that. Wow.
Oh, yes, exhausting energy. So because of that, I really started to withdraw and really would only attend kind of like the most important events, like obviously things like, family weddings or graduations or things that I just had to be at. But it was all still about planning. How was I ever going to manage, doing that? So yeah, life became very small, very focused on the pain. Maybe about 12 years ago, somebody suggested I try yoga. And so off I went to yoga. And from there, I discovered meditation. So I did know from those things that there was a mind-body connection. And, probably from doing those things alone, maybe I felt 5–10% better. Nothing significantly better, but enough to understand that, there was a connection.
You would be getting some temporary relief from the breathing.
Some temporary, yes, from the breathing, learning kind of slightly to calm my nervous system. But, I had no idea about the whole, mind-body connection at that time. And then about 6 years ago, I had to leave the workforce. I mean, up until that point, I had reduced the number of days I was working. So I never worked 2 consecutive days. So I'd work like Monday, Wednesday, Friday, so that I could have day off to lie on the floor in between, kind of thing.
Wow.
Or I'd work a half a day and I'd have somebody else come in, to work the afternoon for me. But it just got that I just couldn't manage the pain at work anymore. And I didn't like the dental hygienist I had become. The pain was just making me not be, the empathetic, compassionate person I had always wanted to be working in the healthcare system. So left the workforce, and I still was under the hope that leaving the workforce would give me some relief, because I was still under the impression that my job was part of the reason that I had the chronic symptoms.
Sure.
But really, when I left the workforce, there was no relief from the chronic symptoms. And if anything, maybe things got worse, because then I was at home alone all day with nothing else really to focus on other than the symptoms.
Wow.
And I should just kind of jump in, and there's kind of something that I forgot to say. So just so people know, even though the back and neck pain were my chronic symptoms, I also had about a list of 12 to 14 what I called my minor symptoms that I was also dealing with, which I now know were all mind-body syndrome. I mean, insomnia, anxiety, hives, knee pain, hip pain. I'd have rashes, very low mood, chronic fatigue, pelvic pain, cystitis, wrist pain. So those were all kind of minor compared to the other things. And I never knew that they were all connected. But so, upon my recovery, which you'll hear about in a bit, but all those other symptoms are also have all disappeared. So they were all mind body.
Amazing.
So I'm done work. I'm at home. Things are no better. I'm continuing to, do the physio, the chiro. My calendar is still full of appointments all the time. Definitely, I had wondered, is there any use, me continuing to do this? I mean, I was the perfect physio patient. I did every exercise, every strengthening, every stretching that I was ever asked to do. I had a file folder of, over the years, all the different things. But I felt like by not doing any of those things anymore, it was kind of like giving up. So I continued to do the same thing over and over. And I know there's a bit of a joke that, the definition of insanity is doing the same thing over and over, hoping for a different outcome.
But I think possibly without even knowing is that you would have been worse. You would have felt worse and felt like at least you're being accountable to what you knew. That's all you knew, and you were being accountable. So
yes. And don't get me wrong, occasionally after a massage or a physio appointment, I might feel better for 5 hours. I might feel better for a day. And hey, one time when they tried dry needling, I think I felt better for 5 days.
Wow.
I mean, now I know that's placebo effect, but so, I occasionally did get some relief from those treatments, but never any long-term relief. So, fast forward to, well, it would have been February 2023. So, it's about 1.5 years ago now. I was at my physio appointment, and I just mentioned to my physiotherapist how I felt that the fear of the pain was just starting to overwhelm me.
Wow.
Overwhelm every aspect of my life. I was afraid to do anything because what was going to bring on the pain? How intense was it going to get today? Was I going to be able to find any relief, etc.? So I just kind of mentioned that in passing at the end of my appointment. And I mean, we briefly spoke of it, but, she didn't have she was still treating me purely in a physical manner. But we had developed a good rapport. So anyway, I left her office still with that kind of on my mind. And I got home, just went to the internet, and I Googled fear of chronic pain. Those were the words I typed into the computer.
Whoa.
And what made me do it that day when I didn't do it, 10 years before? I mean, who knows? Anyway, and up came a few things that I really had never heard of before. Neuroplasticity. I mean, I think I had heard the word, but not in any connection to, chronic pain or symptoms. you know, TMS, mind-body syndrome, Alan Gordon's book. That was one of the things that popped up on my search. So I kind of kept clicking and clicking, and, you know, you can get down going through a rabbit hole there on the internet, but I was reading little brief things here and there, and I was like, oh my gosh, this sounds very interesting. This sounds like it could be something that is applicable to me. So I ordered Alan's book, and it was on my doorstep in 2 days. Picked it up, started reading, and, you know, I probably only took 2 or 3 days to read the whole thing. It's very reader friendly. It's written in layman's terms. It's even humorous.
He's very funny. He's got a very funny sense of humor.
Which is nice, because people in chronic symptoms, you know, we need to feel some humor sometimes. And honestly, I think just by reading the book, I was already 30–40% better, because I understood what neuroplastic pain meant.
Yeah.
I had 100% belief that that's what I had just from reading the book. And my fear had already just started.
Jayne, I'm going to stop for a minute. I totally